Health Insurance Portability and Accountability Act. And one of the main tasks of every caregiver is to establish trust with the person in their care as well as their family members. Being in someone's care is an extremely vulnerable position, and it requires an enormous amount of trust. There are many ways in which a caregiver can foster and nourish that trust by being kind, reliable, patient, and doing their job in an efficient manner and treating both the client and their family members with respect. One of the most important aspects of this trust is keeping the client's personal health information private. Patient data is something that only the patient has the right to share or not share with whomever they wish. A caregiver who shares patient information without the patient's consent is violating the trust and breaking the HIPAA law. In simple terms, to respect confidentiality means to keep private things private. Caregivers, family members, and healthcare providers are in a unique position in which they have access to sensitive medical records and protected health information about their clients. In the course of their work, a caregiver inevitably learns both confidential medical information about their client's physical, mental health, and are also likely to learn other personal information about the client's financial situations and details of their relationship with others. Caregivers should never talk about any of this information unless it becomes necessary. When in doubt, keep it private. Only people directly involved in the health and care of the client should have access to this information. What is HIPAA compliance? The Health Insurance Portability and Accountability Act of 1996. Commonly known as HIPAA, it is a series of regulatory standards that outline the lawful use and disclosure of protected health information. PHI. HIPAA compliance is regulated by the Department of Health and Human Services and enforced by the Office for Civil Rights. Who does HIPAA apply to? HIPAA applies to everyone who is involved in a person's health care, including doctors, nurses, nursing assistants, home health aides, and all care team members. According to HIPAA rules, if a member of a care team wishes to share information about the client with someone, they need to check if the person has HIPAA authorization. Without written authorization, they are in danger of committing a HIPAA violation. What types of information does HIPAA cover? HIPAA covers all personal health information. PHI includes the patient's name, address, telephone number, social security number, email address, and medical record number. It also includes information about diagnosis, mental or physical conditions, medications, and treatments. What steps should a caregiver take to protect the client's health information? Sometimes the caregiver finds themselves revealing information from the client's health record or mental illness by accident. Some steps you can take to ensure this doesn't happen are: first, make sure you are always in the private area when listening to or reading messages. Know with whom you're speaking to on the phone. If you are not sure, ask for a name and number and call back after verifying that you are permitted to release the requested information. Never talk about residents or clients in public areas. Public areas include elevators, grocery stores, lounges, waiting rooms, parking garages, schools, and restaurants. Use confidential areas when reporting to team members when discussing any medical information or PHI. If you see a client you currently care for, a family member or friend of a client you support, or a client you have cared for in the past, please be mindful with your greeting. He or she may not want others to know about your client-caregiver relationship, so it is important to keep it neutral. Please never discuss one client's medical information or any protected health information with another client or support. If a family member or a friend is concerned for your client, please encourage them to talk with the client themselves and make sure they are aware of your professional limitations. Understanding how this law applies to people in service to the client is very important for maintaining professional boundaries. Trust is one of the most important aspects of a client-caregiver relationship. By following these rules carefully, you can work confidently knowing that you are providing quality care while keeping the client's information safe and secure. If you have any questions regarding HIPAA compliance, your client's protected health information, and who you can release it to, please contact Heaven Sent Home Care directly.